Canada has one of the highest rates of diabetes in the world and costs our healthcare system nearly $12 billion annually. November is Diabetes Awareness Month, and on today's To Your Health segment, Hansen introduces us to one woman who has turned living with the condition into a positive.
And now, To Your Health, brought to you by Evergreen Pharmacy and Heart Drugs.
With a simple prick of her finger, Penny Jacob knows where her sugars are.
Good. Now I know exactly where I am as far as my blood sugar.
It's a process she does every morning and night to regulate her diabetes. Penny is just one of 9 million Canadians living with diabetes or pre-diabetes, but she hasn't allowed her diagnosis to slow her down.
Just keeping active, just making sure that I'm physically active all the time. I belong to a hiking group. We hike on Thursdays, and then I exercise 3 times a week, and just a positive attitude, and just really healthy eating too.
Approximately 10% of people with diabetes have type 1 diabetes. It's usually diagnosed in children and adolescents, and it occurs when the pancreas is unable to produce insulin. The remaining 90% have type 2 diabetes, which occurs when the pancreas doesn't produce enough insulin or when the body does not effectively use the insulin that is produced. Type 2 diabetes usually develops in adulthood. If left untreated or improperly managed, the condition can result in a variety of complications.
Healthy eating or improved eating, exercise or improving activity, and medication may or may not be required. So sort of a triangle, and then monitoring of blood sugar.
Symptoms of diabetes can range from unusual thirst to weight change, frequent or recurring infections, blurred vision, to tingling and numbness. It's important anyone experiencing those symptoms see a physician.
Anticipating diabetes is a little bit tricky, only because it doesn't necessarily reflect the fact that people eat sugar, they're going to develop diabetes, or they drink pop or too many candies. But certainly there are classic symptoms of increased thirst and urination. But a blood test is the most accurate way of confirming whether there is truly diabetes.
Self-management skills are offered at the UNHBC's Diabetes Center, and the skills have helped people like Penny, who is currently in training to walk her 3rd marathon. She's proof that living with diabetes is not only manageable, but positive.
It's been a wake-up call, and it's pushed me to be more active and to make sure that I can eat better, and it's just being more aware. And it's actually a positive for me.
To Your Health, Hansen, CKPG News.